Let's get the other latest updates on the COVID-19 crisis. Joining us now is Dr Sneh Khemka, who specialises in public health and infectious diseases and who himself has had the virus.
And with news that Boris Johnson's pregnant fiancee, Carrie Symonds, has developed symptoms of COVID-19, but says that she's on the mend. We're also joined by fertility and expert Dr Larisa Corda. So let's go to Dr Khemka first of all. Thank you for joining us this morning. There's a few things we wanted to clear up. There's certain conspiracy theories that are going around. One of these involves this 5G mask. The theories are falsely claiming that 5G is responsible for the coronavirus, and people have been going around and setting fire to these masks. They've been so concerned about it. Is there any truth in any of this, or is this just complete nonsense?
You know, it's one of the most crazy things that's come out of this virus pandemic, that such conspiracy theories can get so much credence. As a doctor, I rely on science and evidence, and there is absolutely and categorically no science and no evidence that suggests that 5G or any other type of radiation from man-made sources is linked to this virus. And there are theories abounding that this happened in 1918 when we had the Spanish flu because of increased radar around World War I, and other crazy stuff like that. All I'd say to your watchers and to the nation who's listening to this is it is just a load of rubbish. And for those people who want to go and set masks on fire, that in itself, you know, is obviously just vandalous behaviour that people are going to do with any excuse. It's just a terrible shame that we're detracting from the real tragedy of this disease by listening to these conspiracy theories that come out of nowhere.
What we do know, Dr Khemka, is that the peak is coming. And we've been told that. We've been told to prepare ourselves for it, which is why we're all in lockdown now, to attempt to flatten that curve, to stay home and protect the NHS and save lives, which is the message that we're all getting. But in your expert opinion, in 7 to 10 days' time, what will we be facing?
Well, the real answer to this is, frankly, nobody knows for sure. What we've done, lots of medical authorities and research institutions have done this predictive modelling. So what they've looked at is how other countries have fared after lockdown and when they've had their peaks. And we're seeing glimmers of hope coming out of places like Italy and Spain, where there is a plateau. And certainly we've seen it in China and South Korea, where they managed to contain the virus. So we have hope. So in answer to your question, really, Phillip, we think it's going to plateau over the next 7 to 10 days. Matt Hancock has said that Easter Sunday should be the peak. But we don't know. My professional opinion on this is that we will see the peak happening in the next 10 to 14 days. And after that, the social distancing and isolation measures that were put into place will really come into effect. But it comes with a caveat. And the caveat is that the death rate is still going up. We haven't seen the peak in the death rate. And the number of people who are dying has been doubling pretty much for the last few days. So the tragedy is that will continue to rise. And we are just going to have to take every day as it comes and understand what's happened.
Although you've said that social distancing is working, you believed that herd immunity might have worked better.
Well, the government initially embarked on the same strategy that countries like Sweden have got, which was to get herd immunity. And that was the strategy, was that 60% of the normal population would get a low-grade version of the virus, the disease, and would get immunity. And that is one strategy. But unfortunately, a research paper came out of one of the leading teaching hospitals in London, Imperial College London, which changed the view on that. And the thought was, the modelling showed that a lot more people were going to die than initially thought. And so, of course, the government couldn't ignore that advice, and they had to change the strategy into more of a containment strategy. But there's only really going to be one way out of this virus, and that is either vaccine or medicine to treat it, or herd immunity. And my personal opinion is that probably we think that 30 to 40% of the British public may have already had this, just with very low symptoms. Because you know the problems that are there on testing. I, myself, was never tested for it, even though I had all of the symptoms, and I've never been counted as a statistic. So there's a lot of people out there who've got it, and I think we will either get a vaccine or get to herd immunity towards the end of this year, which will really be the way out of this virus pandemic.
Well, we always here like to latch on to any potential good news, and a new study shows that scientists have discovered an Achilles heel of the coronavirus that can be targeted with drugs and other therapies after they examined an antibody from a SARS patient.
Yes, so this virus, the coronavirus, is part of the SARS family, the MERS family, and so acts and behaves a lot like those other viruses. And so where we have found an Achilles heel in that SARS virus, that does give us hope. And the good news is on this that we are seeing clinical trials in humans starting for both medicines and for vaccines. Now, that sounds really hopeful. We need to temper that with a bit of reality, which means that it will take months rather than weeks, unfortunately, before we get a vaccine. There are some drugs out there. People have been talking about azithromycin and hydroxychloroquine, which is used in malaria. And some people are self-medicating with that. My advice to those people is absolutely do not. Those medicines have their own side effects. They haven't been trialed in this condition. We don't know whether they work. There are theories about them working. But if you're tempted to try and get hold of those drugs and take them yourself, just do not do that, because we just don't know what the side effects are in normal people.
All right, thank you very much.
Thank you,
Dr. Larisa, let's come to you now. Obviously, everybody has concerns this morning about Carrie Symonds. She's fiancée of Boris Johnson, who we know has gone into hospital last night. We believe her to be about 6 months pregnant. She said that she has had mild symptoms of the coronavirus. Has she been tested?
I don't believe she's been tested, and I think she actually came out and said that she wasn't going to get tested because thankfully her symptoms are improving and are self-resolving. So that is really, really good news. And it means because she hasn't required hospital admission and because there haven't been any complications to her health, she won't actually get the testing. Also, because she's been self-isolating, she won't have come into contact with any other pregnant women who potentially she may have infected. So these are the reasons as to why she won't need testing. And I believe she's also said she won't get tested.
But we discussed this, obviously, over the past few weeks on here, the concerns to expectant mums. And so what does the virus COVID-19 mean to an expectant mum?
Yes. OK, so great question. In terms of what we know so far about this virus, we have some emerging evidence, mainly from women in China who've had coronavirus. And there is bits of reassuring information at the moment. So this is the fact that if you are pregnant, you are not more susceptible to getting COVID-19 and you are no more at risk of developing any serious complications. However, there is a risk that you can develop symptoms, albeit in the majority of women, these are very mild symptoms, which self-resolve. So that is good news. The other thing that's quite reassuring, which has come out, is that even if you do test positive for coronavirus when you're pregnant, you and your baby should be absolutely fine. The majority of women who've given birth to babies who are also coronavirus positive have been well and haven't developed any serious complications. So this is all good news so far. But where we don't have evidence yet is particularly that first and second trimester, because all of the women we've looked at so far have been in the third trimesters. The virus just hasn't been around for long enough. And it's a new virus. So as we've heard before, we are modelling a lot of its behaviour based on SARS and MERS before. So what we're seeing at the moment is, whereas we thought that there wasn't really a risk of vertical transmission between mother and baby, as placentas and amniotic fluid had tested negative, we've seen one case recently on the 26th of March come out of Wuhan, where a baby tested positive for coronavirus shortly after birth. So this now means that we have to investigate whether this virus is potentially transmissible between mother and baby in the womb. And the evidence at the moment, there isn't a lot of. So we're following up all women in the UK to see what happens. The other thing we're having to monitor is whether this virus is capable of causing any abnormalities in babies, such as growth restriction and other things, and whether there's a higher chance of miscarriage in the first trimester. We don't have the information yet, but we are following up every single woman who tests positive for coronavirus or who develops symptoms to be sure about what the actual effect is. So the evidence so far is reassuring in terms of what I said before, but we just don't know enough yet to be able to completely and fully reassure women. And that's why we're taking the necessary precautions with self-isolation and social distancing.
Is it safe to get pregnant now?
I mean, a lot of people might be thinking about that because they're in isolation, you know, so, well, OK, now's the perfect time to start the family.
Well, Yes, exactly. I mean, it's a really interesting question because we haven't actually had anyone come out and say, no, you can't get pregnant naturally. We know that the British Fertility Association and also the HFEA have come out and said that, you know, we shouldn't be doing any fertility treatment to actively get women pregnant during this time because of what I've mentioned about the fact that we just don't have enough evidence yet about that first and second trimester and whether there may be any problems that women suffer and babies suffer as a result of that. But no one's actually come out and said, no, you can't get pregnant naturally. I would say, look, the decision is very much down to the individual. We can only present what we have so far and the figures and facts so far. There remains some uncertainties. I would urge people to be cautious about that, but I can completely understand that in a state of lockdown, it's kind of, you know, a very natural thing to also want to spend time together and, you know, do certain things together. So it's an unusual situation that we find ourselves in with lots of uncertainties at the moment, but hopefully we will gather more evidence in due course and be able to advise people properly.
And you yourself about to go onto the front line.
Yeah, so I'm being redeployed. I volunteered to work in the intensive care unit with COVID patients. So I'm being moved from maternity to help out there. And it's something that I wanted to do. It's something I feel very passionately about in terms of the fact that we are reaching crisis point and we need every single medical professional that we can get to help in this crisis. And because I'm able to do it, I have the medical skills. I mean, albeit I've not actually treated men for the past 10 years, so that'll be quite interesting. But, you know, I'm really excited about the challenge, and I'm excited to know that I'm going to be doing something to hopefully save many lives. And, you know, not everyone is able to volunteer on the front line. Some people have young children at home, have families that they come back to. They don't want to risk transmission, but everyone is able to do something to help support someone they know on the front line. So my best friend called me up yesterday, actually, and she said, you know what, Larisa, I don't want you coming home after your long shifts, and I'm going to send you some food that you're going to have every night when you come home, something nice to eat, so you don't even have to think about cooking. And I just think, you know, if everyone did a little bit to help someone who is serving on the front line, that would be an incredible thing. And, you know, for me personally, I just want to know that in generations to come, because I know we will get through this, but in the future, I want to know that I did absolutely everything I could.
That's what the Queen said.
Absolutely.
Last night. That's what the Queen said. We should
Good
all
luck and well done you. Stay
look back
safe.
and be proud of ourselves.
Amazing.
Thank
you.
And also thank you to Dr. Khemka as well.